Hi, this is Dr. Keshav Malhotra. I'm the Chief Embryologist of Rainbow IVF Agra and Delhi. And today I'm going to be talking about egg freezing, which is now becoming a real boon for women who want to delay pregnancy. So, like the word suggests, egg freezing basically means that you can store your eggs in sub-zero temperatures and you can use them later on whenever you want to conceive. And this is an option which is really like women who are working, who want to delay pregnancies, who are not married or want to get married later on in their lifetime, they are the ones who are actually using this technology to the fullest. Now, basically, there are three indications for egg freezing. One was which I mentioned earlier. The second one is for cancer patients. So, if you've been diagnosed with cancer, you can get your eggs frozen before you start chemotherapy or radiotherapy, and then you can use these eggs after you've finished the treatment. And the third one is basically for egg donation as well. So, like, even donors can come and freeze their eggs, and these eggs can be given to women later on, and they can actually conceive with those eggs. So, basically, these are the three indications where we use egg freezing. Now, we've been doing egg freezing for quite a while now, and we've had a lot of pregnancies which have also happened with egg freezing. Our survival rates are as high as 99%, and this data has been presented in various international conferences all over. And the probably the best thing that's working for us is that we've tried and optimized the freezing protocol a bit. So conventionally, if you're using a conventional protocol, the survival rates are about 90% or about 80 to 90%, but with the modified protocol we're getting about 99% survival and very good fertilization as well as blastulation rates. Now, how many eggs do you need to freeze in order to get a good success or a good attempt? So basically, it's advised that about 16 to 20 eggs should be stored to get about two good attempts. Because when we are freezing about 16 eggs, we expect about 14 to survive. Out of those 14, about 12 would become embryos, and if you want to follow them till blastocysts, probably out of those 12, you'll get about 3 or 4 good blastocysts, which can be transferred in 2 attempts. So, if you're opting for this modality, try and have about 20 eggs which are frozen. How successful is it? If you look at the literature world over, egg freezing is now a very good option. Like earlier in the days, probably 2008 was the year when they actually declared egg freezing as not an experimental procedure anymore. So now it's actually very commonly used all over, and all celebrities, models, etc., are opting for this because these are the women who actually delay their pregnancy. And why you should actually get your eggs frozen if you want to delay pregnancy, because once a woman crosses 35 years of age, the quality of the eggs rapidly declines. And what I mean about quality is the genetics of the egg. So the chances of getting a euploid egg after 35 goes down to as low as about 30%. And once you cross 42, again, very minimum chances of actually getting good euploid eggs from the pool of eggs that we need. So that is why if you're planning to delay pregnancy after 35, get your eggs frozen before. The ideal age is about 27 to 32. That would be the best time where you can actually get your eggs frozen. But also there are certain women who would have like premature ovarian failure or premature menopause. So these are the women who would probably need to get it done even earlier. And that is why you really need to consult your doctor beforehand. And even when you're like thinking of delaying pregnancy, always go and consult an IVF specialist, and they'll be the ones who will like give you the right advice in order to actually get your eggs frozen. Now, are there any risks associated with egg freezing? Obviously, with any procedure, there are certain risks that can be there. The major risk here is losing eggs. So that is why we say that you should have a large number of eggs which are frozen. So about 20 is adequate. But there can be like days where you might lose all of the eggs, because that's the risk that comes with freezing. So always like ensure that the eggs are frozen in separate sleeves. Ask your embryologist how they're going to do the procedure. Look through the results of the clinic, do your research well, and then only like opt for a clinic to actually store and maintain your eggs. These eggs can be used later on, but the only way that we'll be able to use these eggs is by a modality known as ICSI, because we can't do IVF with frozen eggs. So whenever you come in next with your partner, you'll be doing ICSI for these eggs, where one sperm is going to be injected into the egg, and that will create an embryo which can be put back into the uterus. So this is just a gist of about egg freezing. If you want to know more about this technology, or if you want to get your eggs frozen, do contact us on our website or on our email ID, which is obviously mentioned on our YouTube page. And if you need more videos like this, or if you like this video, please subscribe to our channel.